Hello and welcome to Innovation. Today we'll be focusing on the health sector, and in particular, the innovation is called Mkanda Salama. And to tell us all about this, I have three young innovators, and one of them is called James Kalema. He has a team of two other members, and we'll join them later to find out a little bit more about this innovation. But welcome to Innovation with me, Ivwana Msimembo. James, tell me, Mkanda Salama, how did this idea come about?
This idea came out on 2020 when it was during COVID crisis. Due to COVID crisis, there are a rise of maternal death. So UNFPA through Sahara Ventures conducted an hackathon where they were trying to find any ideas which could try to reduce the maternal deaths, the burden of maternal deaths during COVID. So it's where we came about with this innovation. So Mkanda Salama is the new innovative technological device which has been made by using the polythene fabric materials, and it has been assembled by local engineers who are the doctors and biomedical engineers in Mwimbili University of Health and Allied Science. So the device has been designed in such a way that it can stop bleeding for mothers who are bleeding. For mothers who are bleeding due to postpartum hemorrhage. This Mkanda Salama has been made. It has mainly 5 components. The first component is the compression component, which is here. This is the one which compresses the uterine artery, which is more found in abdominal aorta. Also, it has the compression. It has the massaging component, which is inside there. You can't find it. So this massaging component it uses to make the uterus to relax. Also, we are covering it with the Macintosh. Macintosh, this is the outer covering there, whereby this, because of the condition itself, because mothers are bleeding, so you can find that it can sometimes become difficult for a healthcare provider to wash. So we just put something which can facilitate the healthcare provider to wash it immediately after use. So it is a reusable device. This is the pressure pump. This is the pressure gauge. So make sure that you apply the pressure. The normal pressure is changed from 120 to 90 millimeter of mercury. So you have to make sure you apply the pressure, and you read it here in the pressure gauge. So after reading the pressure, after reaching to 140, automatically the uterine will compress the uterine artery, and therefore you reduce the blood flow. So you have to assess it by doing a femoral pulsation. While you are compressing, you have to take a femoral pulse. Femoral pulse is the one which is being taken here. So when you don't feel the femoral pulsation, it's when you see that you have achieved the hemostasis. So there you can transfer a woman, and you can do other interventions of medical, such as providing oxytocin and other medical drugs.
How long did you take to put this together until it started working? And where did you get the idea from, to put this together?
These ideas have been coming from local medical method which have been used. First, the method which has been used in the hospital, it is the aortic compression. You do by manual compression by using your 2 hands. So you can find that this method is a bit difficult for a healthcare provider to transfer a woman maybe from a health center which is situated 150 kilometers from the other. So you can find that sometimes healthcare providers do get tired and leave it. So we get the idea of taking the issue of compressing. That's why we put this compression component. Also, the issue of massaging, where you can find that the healthcare provider applies the hand of massaging. So you can find that sometimes difficult to transfer a woman while doing massaging. So we try to put all things at once. We assemble compression component and massaging component at once. So this idea has been originated from the normal idea. From the normal methods of medical, which are manual compression and the massaging of the uterus. So we try to put all things at once so as we can facilitate easy transfer of a woman to the S facility where you can receive further interventions.
How long has this journey been to put this together until you are happy with the stage you are right now?
Yeah, for us now, the journey has taken for more than 6 months. We started with the first prototype. It had only a massaging component. Later on, we saw that massaging component is not enough to arrest bleeding, so we went to add a compression component. It's when we started doing a simple pilot. We conducted a pilot study at the St. Francis Referral Hospital. So out of 10 mothers who had bleeding, almost 7 stopped the bleeding after using this device. So it arrested the bleeding for more than 80%. And this we assessed it for those who had the moderate bleeding and those who had mid bleeding. So we wanted to find the results where we can conduct for us a large clinical trial. And fortunately enough, we presented the results during Tanzania Health Summit, which was held in Dodoma on October last year. So we shared our findings with other stakeholders in maternal health, and they were happy of it. First is to bring them aware of what Mkanda Salama is, and we look forward to other partners to join us in this journey of doing a clinical trial and trying to reduce maternal deaths due to PPH.
Okay, so I'd like to meet your other team members. Maybe I'll talk to Pascal right now. Pascal, you're part of this team. What sort of challenges did you face when you came with this idea of Mkanda Salama?
The challenges that we have so far faced up to now, the first challenge, that the very big challenge for us, is about the initial funds. As you know, we are still students, we are young people. We don't have a lot of materials that you can process to make our ideas bigger. So we are looking for people who can just assist us and help us so that we can make more other instruments so that to help the people, especially we are focusing on in the rural areas. As you know, in the rural areas, the health facilities there are no such experienced professionals. So normally women are transferred from the low health centers to high health centers, so that we need now to reduce the maternal death around those areas. So the big challenge we are facing up to now is the initial funds. So we are looking for partners, stakeholders, or even is the government, which can at one point or another can help us to process ideas further. That's a very big challenge of being facing.
But looking at this innovation, Mkanda Salama, who came up with this idea?
The one who came with the idea is James Karema, because he was doing his clinical studies at Ifakara Health Institute. So he arranged the maternal breeding during delivery. Also the intervention that were available at that time, the local interventions, is where when he came with this idea of doing something to compress the abdominal aorta. So we are later on included in the project because we are helping to read the literature reviews, other research, to conduct a various number of researches, to do the presentations in various summits, as you explained before.
Okay, so looking at this innovation, what would you like to see being done right now?
This kind of innovation, right now, we need first to make it known to the public as well as the government. So what we want to do to address to the community of Tanzanians and the government at large, that we have the intervention. So if it's possible, by the Minister of Health can adapt it to be provided to other health facilities so to solve the problem that we are trying to address. That's the main issue that we look to address to the community, and we need our project or our intervention to be known.
You said it works, the efficiency of it is about 80%. What more would you like to see, maybe to make it much more efficient, done to this innovation? Do you want to make more improvements on it, or are you just happy with the way it is right now?
The first time we started with it, it was very low, that its efficiency was low. So we are working to improve it further. Now we have done a retro to make it at least 80% efficiency, but we are looking further for other interventions. We are still reading various literature reviews, various other innovations from other countries. So we aim to make it more perfect later on, but right now we are planning to start with the way it is first. Yeah, for the next 1 year to come, we hope to improve it more.
What's the next step right now, with what you've done so far?
The next step right now is that we want to make more other products for the other trials to be conducted all over the country. That's the main issue that we are now targeting to do.
It was nice talking to you, Pascal. So I'll go on and then meet another team leader. Hi.
I'm Frank Musa, a student from Wimbili University of Health and Allied Science.
Okay, so in this team, what is your responsibility?
My responsibility is to make sure that anything is going well. I'm in organization category, so I'm making sure that James, Pascal, they are working to make we achieve our goal.
What do you feel about this innovation? Are you happy? Are you satisfied? What can you tell us about this innovation?
For this moment, I'm not satisfied because we still not meet the target to reach the maternal mothers, especially that are found at the rural areas. So I will be happy when we reach at least 100 facilities in Tanzania and elsewhere across the boundary. So I will be happy when I'm seeing the Mkanda Salama is in all Tanzania, and all mothers are saved with our Mkanda Salama.
Okay, so what do you think needs to be done to make sure that you make that achievement?
So the first thing is the adoption by the government, so that the government can adapt this and supply to the different facilities, but also different healthcare stakeholder can join us and to make sure that this journey is going on, so that we can reach every facility in Tanzania.
So what has been the response so far since this innovation has taken off from the government and other stakeholders?
We are meeting a few stakeholders that help us to especially our teachers and professors that help us to join several ideas, and they are helping to monitoring us, give us mentorship. So we are just meet a few stakeholders, and we are looking forward to other stakeholders that can help us in terms of financially, so that we can produce a lot of Mkanda Salama that can be supplied in the country.
During this trial of this Mkanda Salama project at Ifakara, did you have the opportunity to go down there as well?
During that time, we sent a team lead, that James. He went there so that he can oversee the activity of trial. But we are there at the university, and we are proceeding with other activities.
So yeah, nice talking to you, and well, let's find out more about how this Mkanda Salama actually works. We're going to do a demonstration, and you'll show us how this Mkanda Salama actually works. But before we do that, I just wanted to find out, when you did this trial at Ifakara, how was it?
It was a simple trial which took almost about 6 months. It was from November up to April. We conducted a trial. First is to see first its efficiency, first in a small population. So that we can generate the findings which can help us when we are conducting the large trial. So it was we had the results, and as I already mentioned, that is almost tried to arrest the bleeding for those who had the mid and the moderate bleeding for more than 80%. So you can find that was the first, or the second product. So you can find that if we should further improve it, it can further reduce blood up to 90%. Also, we wanted to do a multi-centered trial, whereby we should do our trial in different test facilities. Also, we should try to assess on how can Mkanda Salama being used together with other interventions. We see how effective it is when using Mkanda Salama alone, or when you use Mkanda Salama in conjunction with other interventions. So it's our second phase of trial where we shall do it, and for now we are kind of seeking for any partner who can support us in this journey, especially in reducing maternal deaths in Tanzania and other sub-Saharan countries.
James is going to show us a demonstration to see how this Mkanda Salama actually works, and we have a volunteer for us who's going to be our expectant mother. Okay, James, go ahead.
Okay, so as we tell you, this first part is one which is being tied up here on the top of the abdomen. So this one is, Mkanda Salama kit has been, it should be put on the abdomen. When the woman delivers, the uterus descends up to 20 centimeters, which is found in the umbilicus. So you have to fix it on the umbilicus. You have to put it, you have to make sure it is in the center of the abdomen. So, and then this one has to be placed at the back, so as to reduce the risk of her to get the bed sores. That's why we try to put this, and to increase the comfortability of the patient when you are transferring her. Before starting applying the pressure, you have to assess the femoral pulsation. That means the blood which flows in the femoral artery. The femoral artery is around here. So we have to assess if the blood flowing. If you find the blood flowing, this should be your indicator of saying that there is a good blood flow. And this will be used as the assessment to assess if the Mkanda Salama has worked. So when you feel that the femoral pulsation has failed, you don't sense again, there is that you have achieved hemostasis, you have reduced the bleeding, which has been originated from the abdominal aorta. So here I'm starting applying pressure. So the pressures normally reach to 140. This is the demonstration. I don't like to apply 140 because it will compress her. So I just see, and then I assess the femoral pulse. So from now I can see that the femoral pulse, doesn't percent. So I see that I have tried to achieve hemostasis. So Mkanda Salama has managed to compress. When you apply pressure here, it massages the woman automatically. So you can find that this is the tonicity of the uterus is one of the leading cause. It's one of the first number one cause of PPH. Yeah, so this is how Mkanda Salama works, and then you can transfer a patient. even for 3 hours with this Mkanda Salama. So when you are transferring her, you can doing other interventions. For example, you insert the IV cannula for intrauterine intravenous fluids. So you can do oxytocin, you can assess blood pressure. So you transfer a woman in a relaxed way. Also, for example, when you are in the facility where you want to transfer a woman to the theater, it is very easy because when you have already assembled her, you can take her in the theater. When you reach the theater, you remove it and then you go. So it's very comfortable for women. It is applied externally, so there is no risk of maternal sepsis as compared to other interventions which have been used previously. For example, condom tamponade is inserted through the birth opening. When you find the uterine balloon tamponade is also set intrauterine, those are the risk of PPH, and then they require, you need to be obstetrician, or you need to have a level of healthcare providers, whereby in most of sub-Saharan countries, they don't have such level of expertise.
So this can be used by a nurse?
Yes, yes, by the
nurse.
nurse. It can be used by the nurse, can be used by clinical officers, it can be used by obstetricians themselves. So it has been made in such a way that it can be operated by anybody. So you need a little bit of training so that you can know the pressure ranges, you can know where to move it, also how to apply it in the specific site, and how to take femoral pulsations. I think this is good for a person who has a certain level of expertise, especially in medicine, to do this, but low level of medicine.
Okay, so do you use this when the expectant mother is in danger, or just as a routine, just to check the status of that, of the health of the expectant mother?
This one is being used only when maybe the mother has delivered with the postpartum hemorrhage. Postpartum hemorrhage is it's a blood loss that occurs immediately after delivery that leads to hemodynamic instability. So when you find the mother has delivered, especially through normal route, so there you have to make sure that it's when you apply Mkanda Salama kit. So you find that the mother is bleeding profusely. We are trying to make it more comfortable, and we shall try to train not only healthcare providers who are found in the next facility, but also ambulance services. For example, ambulance services is found in towns, but for us, our main focus is the village, where this intervention will be made in the rural areas where there's a problem of transferring a woman, and where the health facilities are spaced geographically, very long distance. There is where intervention is mainly focused. Our focus is only rural areas. Urban areas it's good because there are roads and roads, so it's easy to transfer, but also they can use it. But our main focus is the rural areas.
So very quickly, maybe you can tell us, okay, so from here, what more should we expect maybe in the next coming months this year? Where would you like to see yourselves with Mkanda Salama?
In the next few months, first we shall try to make this device to be more comfortable. Also, we shall try to make the device to be more effective. The good thing which we have in Muimbiri, we are having biomedical engineers who are students. This is the first intake of biomedical engineering in Tanzania. So it was a bit of a challenge to work with students who are not biomedical engineers yet. So, but for now they're in third year. I think it's an opportunity for us to work with them. Also, having doctors around. Also, it's also being allowed, I think, because Muimbiri is a public university, it's easy for us to interact with the government, to give permission to do multi-centered trial, and how we can present our findings globally, and how we can reduce this thing in not only in Tanzania but other countries which are facing the same problem like of us.
Okay, so maybe Pascal, we can finish with you. Optimistic? Do you see a good future with Mkanda Salama?
First of all, we are grateful that we came up with this intervention, as we said before. So with Mkanda Salama now, what we are focusing to, as James has explained here, is that we need to do the large-scale intervention or the clinical trials. So what we are expecting now is to get just a permission to go to other health facilities where we can test our tool. Also, the other issue that I can speak here, our target group mainly are the health facilities. We not encourage so much to be provided to the pregnant mothers at homes, because we don't encourage delivery at homes. As you know that it's a bit challenge and dangerous for the man to deliver at home. So this intervention will be provided at the health facilities, not in the homes. So that's the way to improve this, the life of mothers as well as the babies at the river. We will provide this one to the healthcare providers who have low knowledge, or the ones who cannot do the massive intervention during the river. That's our main target for this now.
Okay. And maybe what would you like to see with Mkanda Salama?
Actually, what I would like to see, Mkanda Salama is prosper, is going across our country, but also abroad, across East Africa and Sub-Saharan Africa, so that those pregnant mothers can feel comfortable during delivery, especially in the village area. So I want to see Mkanda Salama to be in dispensary, in the healthcare facilities, even in the national facilities, so that those pregnant mothers can feel comfortable during their delivery.
What I think about the Mkanda Salama innovation is a very good help to the people in our community, especially those in rural areas, as the most of women, pregnant women, get complications during delivery. So it's going to help them. They may enjoy giving birth and not find it as a burden or something like that.
What do you hope to see from this Mkanda Salama, from what you've seen so far?
What I see about the Mkanda Salama is that's going to be of a good help, not only in our country, but also outside, in other sub-Saharan countries. That's the ones which are facing a lot of difficulties, and it's going to save the lives of many women.
I had this team of young innovators talking about this intervention, this innovation called Mkanda Salama, and I wish you all the best in this innovation. From me, Yvonne Msemembo, it's goodbye until next week.